name is Amy Deal. I'm a project director for the Education Development Center, and this presentation is about addressing SRGBV, or school-related gender-based violence, through school leadership and community engagement. This features work done in the USAID Liberia Accelerated Quality Education for Liberian Children activity. The AQE activity is designed to provide access to quality education to 48,000 children aged 8 to 15 years who have dropped out or have never been in school. The overall goal of the AQE activity is for overage learners to access and complete quality lower basic education and transition to the formal education system if age appropriate and or to alternative programs. As the project started up, a rapid education risk analysis and gender analysis were conducted. The RERA was designed to capture information about how education systems, learners, and their communities interact with a dynamic, multi-risk environment and how those risks in turn impact project activities and outcomes. It identified significant barriers to access ALP, including cost of schooling, as well as safety concerns ranging from harsh corporal punishment to bullying and sexual violence. The research found that these issues disproportionately affect girls, as well as other vulnerable groups such as children from poor families, children with disabilities, and those living with one or no parent. More specifically, the RERA results suggested that curriculum, pedagogy, and related training should focus on creating a learning environment that is free from corporal punishment and promotes respect among learners and between students and teachers. Additionally, the RERA suggests that the PTA should receive training in conflict resolution to help resolve issues arising between parents and teachers. The gender analysis identified gender-related gaps and barriers that exacerbate gender inequalities and thwart improved education outcomes for Liberian girls and boys, with a special focus on accelerated learning programs and children with disabilities. The analysis demonstrated that the majority of the constraints faced by Liberian young women, children, and children with disabilities are linked to inequitable gender and social norms. SRGBV was identified as a significant barrier to students' education achievements, impacting learners in several ways, and that when school administration does not enforce disciplinary measures against the perpetrators, girls are especially vulnerable. In addition to the rapid education risk analysis and the gender analysis, the AQE activity decided to undertake a safer learning environment, or SLE Baseline assessment, which was conducted about 18 months after the other assessments in September and October of 2018. It updated and validated key findings and potential interventions that were also part of the results of the other assessments, and provided further information on specific elements of SRGBV, which is also a critical component of school safety. While most learners and school personnel perceive a positive school climate with regard to acceptance of diversity, there is room for improvement in terms of treatment of students with disabilities and students who do not conform to gendered expectations. Additionally, 86.4% of learners reported that they were worried about their safety from any type of school-related gender-based violence while going to and from school, compared to 21% or 20.9% that were worried about their safety from SRGBV risks while at school. This suggests a need to promote agency for children's safety within communities, something that parent-teacher associations or PTAs can do. Additionally, the findings validated that bullying, sexual violence, and corporal punishment were widespread in schools. These elements of SRGBV were studied further, and learner questions on these issues included scenarios that depicted bullying, sexual violence, and corporal punishment. So in regards to the bullying scenario, the SLE assessment found that about half of learners reported that they heard about someone in their school that experienced bullying. Others, about 40%, reported that this happened to a close friend or family member, and 30% reported that something like this happened to them in the past year. So about half of the learners, 55% of the learners, said that they reported the bullying. The data shows that bullying, including reporting and response to reports, is an aspect of school safety that needs to be addressed with learners, parents, and school personnel. Sexual victimization or sexual violence victimization is also widespread. 37% of the learners reported that they heard about someone in their school who experienced the sexual violence depicted in this sexual violence scenario in or near the school. 36% of the learners reported that they've seen a student being treated this way by other students, while 61% of the learners reported they had at least once experienced such a thing themselves. Reporting of sexual violence was infrequent. Only 33% of the learners who reported having experienced sexual violence said they told someone about it. According to the baseline study, corporal punishment is about as prevalent as sexual violence. 37% of the learners have heard about someone in their school who experienced corporal punishment in the same or similar way to the scenario depicted. 30% of the learners had observed a student being treated this way, and 30% had also reported that such a thing happened to a close family member or friend, while 22.5% reported that this had happened to them. In addition to these topics, the SLE assessment also spoke to health and environmental hazards and substance abuse and gang influence. Substance abuse and gang influence were minimal and thus was not directly targeted in our activities. A key deliverable of the activity was to develop a community engagement plan to address school-related gender-based violence in AQE schools. Data from all three of these assessments was used to develop the community engagement plan and a further parent-teacher association or PTA pilot series. PTAs are made up of parents with the school principals as secretaries. PTAs are critical to addressing the school safety needs at the school and in the community, and are central to the whole school approach to addressing SRGBV, as you can see from this diagram. So 25 school PTAs were selected from the pilot series across the 6 project counties. The Lot Quality Assurance Sampling Method, or LQAS, was used to select the PTAs. This allowed us to select the schools for the pilot that were considered the least safe based on learner data from the SLE baseline scenario questions detailed in the last slide. The PTA pilot series consisted of 6 events on a variety of topics related to preventing and responding to SRGBV, including child's rights, gender norms, establishing a network of trusted adults, understanding and preventing bullying, sexual violence, reporting SRGBV, and corporal punishment and positive discipline. Events varied from 2 days in the case of sexual violence to a few-hour meeting with a cluster of PTAs. Each event produced planning documents for PTA-led community activities. This slide shows some of the types of activities PTAs produced or plan to produce in their communities. Activities range from identifying and forming groups of trusted adults, creating bullying manifestos that provided a framework for how schools, including parents, school staff, and learners, would address bullying. This was actually a very popular activity. Also introducing the topic of psychological first aid, which could be used if a learner reported sexual violence or other trauma. Sharing a referral mechanism called the Learner's Path to Help, and conducting classroom observations to support positive discipline techniques in the classroom. We believe a key factor for success with the PTA pilot series was the variety of partnerships that were established with events and community activities. Much of the AQE work is done with and through technical working groups comprised of Ministry of Education officials. The SLE assessment and PTA pilot series were advised by a number of Liberian Ministry of Education officials from School Health, Alternative Education, Planning, and the Girls Education Division. Ministry of Health and AQE activity staff were also engaged. As the pilot series developed, Ministry of Internal Affairs, and the Liberian National Police were engaged to provide support at events throughout the 6 counties. Several pilot events, most notably the 2-day event on sexual violence, included attendees from the Women and Child Protection section of the Liberian National Police, community, social, and health workers, county gender coordinators, and traditional leaders. The vertical engagement from various ministry officials provided emphasis and opened the door for the horizontal partnerships with the other actors at the county and community level, which, based on a widespread feedback we received, was not standard practice. These horizontal partnerships allow PTAs and traditional leaders from the 25 sites to sit, talk, and engage with representatives from the police, social and health workers, and gender coordinators in a way they hadn't before. Meaningful connections were made that allowed PTAs to further understand and have access to resources that were available to them as they worked to prevent and respond to SRGBV and improve safety at schools. In September and October of 2019, EDC conducted the SLE Midline assessment, and this slide presents findings on key components of SRGBV. You'll see that the chart here shows pilot sites results from baseline through midline and non-pilot site results from baseline and midline related to bullying, sexual violence, and corporal punishment. We gathered a lot of data, and the midline report will be available shortly, but the data you see here are learner responses to questions on scenarios that depict bullying, sexual violence, and corporal punishment. It's important to note, though, that as you'll recall, the sites selected for the pilot activities were based on being less safe than others. In addition, the sample size for the pilot sites were small. However, when looking at the three forms of SRGBV overall, the effect of the SLE pilot shows some positive results. For example, in the bullying category, you'll see that learners in pilot sites who answered yes to "has anything like this happened to you" reduced from 33.3% at baseline to 18.9% at midline, while 23.3% of the learners in non-pilot sites at baseline answered yes to that same question, and this was reduced to 21.9% at midline. There are similar results when learners were posed the question, have you heard about someone in your school that experienced the same thing or something similar in or around school, and has anything like this happened to a close friend of yours or a family member? In the sexual violence category, the number of pilot school learners who said yes to have you heard about someone in your school that experienced the same thing or something similar in or near your school in response to the scenario on sexual violence was 39% at baseline and 21% at midline, while 33.7% of learners in non-pilot schools answered yes to this question at baseline and 28.4% at midline. In the corporal punishment category, the number of students in pilot schools who answered yes to the question, has anything like this happened to you, was 23.5% at baseline and reduced to 10.8% at midline, while in non-pilot schools, 21% of learners answered yes to baseline and 18.8% answered yes at midline. There are a few other interesting findings from the SLE Midline study that we thought were worth mentioning. 28% of pilot sites said that they were aware of at least one reporting mechanism for violation of school regulations and rules, compared to 21.5% of respondents from non-SLE pilot sites. This was interesting to see, as several of the pilot events covered how to report violations of teachers' code of conduct and rights of a child in school. 96% of school personnel believe the PTA is adequately equipped with the skills they need to do the work they are tasked with regarding safe learning environments, as do 79.8% of parents and caregivers. On the other hand, 66.6% of PTA members believe that there is a match between their skills and the needs of the school. Findings suggest that the PTA has been effective in making the schools in which they work a safer place. Nearly all of school personnel and parents and caregivers believe that the PTA has been effective in making inside and outside of the school a safer place. Based on data from baseline to midline, PTAs can make a difference. As you saw on a previous slide, we have seen improvements related to bullying, sexual violence, and corporal punishment in the PTA pilot sites. So there is some indication that working through PTAs to address these issues can be worthwhile. There is a difference between school personnel, parents, and caregivers' perception of PTA members' skills and effectiveness and those of the PTA members themselves. This needs more unpacking. What are ways we can continue to support and empower PTAs so that they see themselves as skilled and effective, for example? Engagement of staff from ministries was an important success factor and not regularly done. And MOE partners were eager to work on these issues from the beginning and have requested training and other materials to support them as they continue. You can see the quote here from Lopumana, MOE Director of Girls Education. She has also stated that she wanted the materials for the events as soon as possible and highlighted the work we did through the pilot series on establishing a simple referral pathway for reporting SRGBV as important for her work. As you can see here, there are some next steps for the program as we incorporate lessons learned, refine the pilot series for the Ministry of Education, and possibly complete the endline